Health is wealth, goes the popular saying. Therefore, to ensure the well-being of every citizen, health policies must be inclusive, catering for both able-bodied individuals and those living with disabilities. This report delves into the efforts of Cross Rivers, Edo, Lagos, and Osun states towards creating solutions to the challenges faced by persons with disabilities in accessing quality healthcare and documents how inclusive are the various health insurance schemes in these states, as well as the way they are enhancing services for this special component of the population.
It has been so great. Health insurance, Osun Health Insurance Scheme is a form of managed care, and it has assisted a lot of people, at least who cannot afford good health, to make them afford a very good condition, a good health. And for those people who are having disability, it's a very big plus for them.
Osun is a state in the southwest Nigeria and has a population of 5 million people. Of this population, the chairman of the Joint National Association of Persons with Disabilities, JUNAPID, in the state, Mr. Oluwafemi Stephen, said over 9,000 were persons with disabilities who are spread across the 30 local government areas in the state. Mr. Stephen attested to the benefits of the Osun State Health Insurance Scheme, HOIS, and explained how many of his members were brought on board. Since their enrollment, he said they had been enjoying free healthcare services devoid of out-of-pocket payment.
My people benefit, but for a year. Our last governor, former governor Adebiyi, did a kind of health insurance for person with a disability for a year period. I think 2021 to 2022.
This claim was corroborated by the Executive Secretary of the HOIS, Dr. Adebiyi, who said that the persons with disabilities were captured under the Vulnerable Group Health Plan of the scheme.
The last count, we had over 256,000 lives that have been captured in the scheme that are in the health insurance net in Osun State. 94,920 of them are formal sector participants, out of which we have 40,351 principal, and then we have 54,569 dependents. And then in the informal sector, which is the biggest hard nut to crack, we have just 3,928, with 2,803 being principal and then 1,125 being dependents. In our state equity program, we have 34,444. The state equity program is the vulnerable group program that is funded by the state, and that's 34,444 people. Now, under the Basic Healthcare Provision Fund, we have 40,191. Basic Healthcare Provision Fund is the vulnerable group program that's funded by the federal government through the Basic Healthcare Provision Fund, which is established under Section 11 of National Health Act 2014. So that's the number that we have under that group. The definition of our vulnerability is simply that if you are an indigent, you are a poor person, the poorest of the poor, you don't have any means of livelihood, or you are a person that is living with disability that does not have a means of livelihood, you are a pregnant woman, you don't have a means of livelihood, you are a child, of a poor person that does not have access to healthcare by virtue of the poverty vulnerability of your parents. Now you are a retiree and you are not even on pension yet, you don't have gratuity, and then you need to be taken care of. Those are the things, the aged above 60, indigent aged above 60, amongst which we have some retirees. Some retirees do not qualify, but some do. So we have our targeting, criteria to target the people that are vulnerable. People living with disabilities are also just one group of the vulnerable, group.
The policy is the same in Cross River, as confirmed by Dr. Comfort Ekanem, the permanent secretary in the State Health Insurance Agency.
The people with disabilities are those that are under the vulnerable group. And we said that the Basic Healthcare Provision Fund takes care of the vulnerable. And if you are those with a disability, you fall under this group. So federal government has made provision for the fund that takes care of them. And these are persons that we believe they stay within their communities. So what we do, we register them. So we go from LGA to LGA within the community using the gatekeepers to fish out those who are vulnerables, and then we register them into the scheme, and we now give them ID card so that they can now, and we empanel them to the PAC that is closer to them. So from there on, they will start accessing care through this funding of the Basic Healthcare Provision Fund.
In Edo State, through its Equity Health Plan, 39,000 vulnerable persons have been enrolled into the scheme, accessing free healthcare services. Among these vulnerable persons, Dr. Rock Amego, the Director General of Edo Health Insurance Commission, said persons with disabilities make bulk of the enrollees.
You remember when I was talking about federal and state government, we were talking about the vulnerable people. And so when we say vulnerable, we group those people, that get less than minimum, that are more deprived if they are financially hit, if they are economically hit, we put them in a vulnerable group. And if you look at this group, they are basically pregnant women, all right, children under 5 years of age, because between birth and first 5 years of age, that's when you have a lot of childhood illnesses. That's when children are not vaccinated, they can have a lot of complications. So that group is there. We also cover for our elderly, all right. Elderly for us, we said above 60 years of age. Why did we say that? The longevity span in our country is between 53 and 54 for males and females. Other countries are much higher, but so we said 60 years of age if you're older than that. And of course, those who are living with permanent and visible, disability, such as the one you just talked about. People who have some blood disabilities, who cannot pay for themselves, such as sickle cell anemic patients, all right, those who have had accidents and cannot fully function in the society, those are the vulnerable. That's the one we said that we have covering 45,000 people this year, but we have already covered 39,000, so we have 6,000 to go.
Meanwhile, enrollment of persons with disabilities for the health insurance schemes in these states are not limited to vulnerable groups, as many persons with disabilities who are civil servants are also captured under the Civil Servant Health Plan of the scheme. Chairpersons of Jonapates in the states said,
Yes, because I'm a civil servant, so it is compulsory for all civil servants to be registered for the health insurance in Osun.
I'm very much aware. As a staff of the local government, I'm already on the scheme. As a staff of the local government, I'm already on the scheme. And the scheme is a very good one to be a relief for staff.
National health insurance scheme was not, it was to my knowledge, but our persons didn't benefit enough there. But at this care, most of our persons benefited from that scheme. Those who were able to approach the contact of the person who was in charge of our care were always taken care of from my union, mostly.
Dumbiri Frank Ebo is a visually impaired man who lives in Lagos State, and according to him, he does not pay any premium as he is captured under a vulnerable group. Ebo explains further.
To get a form through NAB. NAB is Nigeria Association of the Blind, Nigeria Association of the Blind, Lagos State Chapter. So that was where I went. I filled the form and it was submitted. I was told to choose a health facility that is very close to me. And I chose Abbey Road Hospital. So, and it was activated. Initially, I did not get my policy number. People were complaining. Many other people were also complaining until they sent a particular phone number on our platform, on our WhatsApp platform. So I called that number, and in the process, I was able to, my policy was activated, and I was given my policy number.
Nevertheless, some persons with disabilities are not captured under the vulnerable group plan, but through other means, such as private registration and civil service onboarding. This is a situation for Oluwakemi Enyefunjowo in Lagos, some persons with disabilities in Osun, and also some in Cross River whose registration was paid for by the association as stated by Honorable Ebenga.
Well, the first time I heard about it was when I put to bed, when I had my first child. So they told me about it at the maternity that I used, and that was Avenue. So through that, I registered. So that was I used for that year. That was 2021.
I've answered the question now. The special premium package is this basic health provision fund I'm talking about. And further to it is the clarion call that I'm asking individuals, NGO organizations to bring in their fund into the scheme. For example, now as we're talking about this physically challenged, somebody can say, okay, my own contribution into the scheme is for those who are physically challenged. And he or she may further want to go to segregate the kind of challenge that he or she will want to assist. You know, like people having foundation, for those who are blind, for those who are crippled, and etc. etc. So these are premium packages that will take care of them.
How do equity funds covering vulnerable persons work? Dr. Okini, the Executive Secretary of OIS, explains.
40,191 of the vulnerable groups are paid for from the federal government, that is the Basic Healthcare Provision Fund. 34,444 are paid for under the State Equity Program, which is also for the vulnerable persons.
In basic healthcare provision scheme or basic healthcare scheme or possible state health insurance scheme is a scheme that is inclusive. We include everybody. You know, we talk about inclusion, we talk about equity, So this scheme is so beautiful. The tall, the short, the able, the disabled are all include into the scheme, and they are all given equal rights.
During this project, we found out that the major limitation of these equity funds is that it brings about uncertainties as many subscriptions have expired without renewal. This is a case in Osun, Lagos, another state as explained by Mr. Stephen and the State Secretary of JUNAPID in Osun, Mr. Smith.
We are going to be having free health care. Are you getting this, sir? At the long run, we all registered, even with our our NIN. Yes, we use NIN to what? To validate the ID card, the process, the registration process. So, but later on, I went back to make use of it because I wanted to renew my classes. And I said, let me go to NHIS, OHIS and see. They now said that when I got to the office, they said, no, this one is not like that too. I need to pay. I need to pay by 12,000 something so that I will be able to make use of the OHIS. I said, but you told us that this thing is free. So I just left here.
We register for under Adebiyi, Nigeria Association of Blind. So mo dẹ̀ low. Gẹ́gẹ́ bó ṣe tó àtúnṣe yẹ. But ètò wà bẹ́ẹ̀ ni pé láti last year, that's 2022. Tí mo débẹ̀, wọ́n ní kò sówó ń bẹ̀ mọ́.
Not at all. because since the government did that things during that period, there's nobody to come to our aid to do a search for our members.
The same is the situation in Lagos State, as revealed by Inyifunjowo.
We actually made effort to register, but our policy number was not released to us. We couldn't get a policy number at all. My husband went to there was a time they actually asked them to compile a list of those who didn't get their policy numbers. My husband submitted our name because we actually registered as family. That's the packaging we were doing. So he told them. Eventually, he didn't get any feedback from them. So that's like, okay, fine, let's start using our own money. And since then, we've been renewing it with our own.
Also, among the challenges observed by our reporters in the inaccessibility of some hospitals are sites to enroll persons with disabilities. The chairman of Osun revealed this.
Some of people in the society stigmatize the person with a disability. It also happens in the health sector. So there's some problem. You know, when we talk about the problem concerning the health, it also affects all aspects of life of person with a disability. For instance, in that hospital we want to go in to seek for health assistance or whatsoever, it's not accessible for person with a disability. For instance, those who are using wheelchair in a place where there is a step that wheelchair cannot pass through, and for the deaf people, no interpreter to assist them to complain their problem they are facing health-wise. That is another thing.
However, the OI's boss, Dr. Niyi Ogini, highlighted how the organization is dealing with some of the complaints received.
Yes, most of the hospitals that are accredited have ramps. That's the kind of thing you're trying to say. As part of the criteria for accreditation of facilities, we put in the place how accessible these facilities will be for people that are living with disability.
How does the project also provide solutions to infrastructural deficits at hospitals? Dr. Ogini explained that his organization does monthly evaluations and works with hospitals to provide both human and material resources needed for effective discharge of sources in hospitals.
Every quarter, 3 months, they send us a quality improvement plan. In the quality improvement plan, we look at the 3 domains of quality: human resource, that is personnel; infrastructure and equipment; medicines and supplies. These 3 we don't joke with. Now, when they submit their quality improvement plan to us, in conjunction with the hospitals management board, I'm talking about the government hospitals, we will look at everything. Okay, you have a shortage of doctors, you are going to get one ad hoc doctor. You are going to get a local doctor that will work in that place. Then you don't have enough nurses, you are going to get, from your capitation, you are going to get local nurses. You are engaging ad hoc nurses. And then you don't have pharmacy, we are going to do that. And that way, we have been able to improve the personnel strength of the 16 government hospitals that are accredited to provide service.
As stated by Inyifunjowo in Lagos, Stephen in Osun, Ekarem in Cross River, and also in Edo, enrollees, most especially persons with disabilities, pay more for drugs. This is placing more burden on them.
Tó bí ẹ̀mejì tó jẹ́ pé èwo tí mo bá wọ síbẹ̀ ìyẹn nípa pé mo ní cough ikọ́ bọ̀ sígbà mo ṣàlàyé fún wọn tí wọ́n pé owó yẹn ó tó nǹkan bí at least price yẹn ti tó nǹkan bí 2,500 àbí 2,000 wọ́n pinnu láti kọ orúkọ ògùn yẹn fún mi pé sáré àkèmú wá tàbí kí n lọ rà á níta.
I remember also there was one day I went there and I took my son for an ear problem. And they recommended, initially the doctor wrote down some prescriptions, about 5 of them. But when I got to the pharmacy, as soon as they saw that it was from the health insurance policy, they reduced it to 2. And out of that 2, they said they had only 1. And that one was um, this medicine for fever, paracetamol. That was the only one I got.
Since the government then give them fund, and that subsidize of that drugs, people with disability don't have money to meet demand too, is another problem. If government want to assist us in such area, they supposed to provide drugs for us free.
Why thank you them for making it free? And then, like I said, I'm still reiterating it, that let it be a holistic approach. Everybody with disability, including me. There are days that I may not have money to buy. Is it ordinary Panadol they call it? So if I go there, it should also be free for me, irrespective of the fact whether I will or not.
However, the Osun Health Insurance Agency has a way for these to be addressed by other agencies.
We have a drug distribution center. As you are coming in, you can film our drug distribution center, you sit there. There, we started that because of the incessant complaints by enrollees that when they get to the hospital, they tell them, oh, it only covers paracetamol. They don't have drugs and things like that. So we started that, and we stocked it with the essential medicines on the list. So the government hospitals don't need to come and pay money before they come for the drugs. They just come for the drugs at the beginning of the month. We give them the drugs, and it is costed. At the end of the month, we know what capitation we're going to pay them for next month. We deduct the money for the drug, and if the money their indebtedness is too high for the capitation, we'll just say 50% of it, and we'll roll it over to the next one.
One of the challenges that they will have a lot of drug stock out. So if I come to a facility and I feel sick, and I go there, they don't have medication to give me, I'm not going to go back there the next time. And so we started plugging most of these challenges. We did somewhat of an implementation research to find out what challenges. We started putting a lot of manpower within those facilities. We started putting drugs. We started painting them. We started making sure they were places that were inhabitable. They had water, they had electronic medical records. Those that do not have ICT systems started putting ICT system so that our doctors who are in the urban area can, speak to some of our first responders when it relates to talking to our enrollees within those centers.
By various states in Nigeria, to make healthcare more inclusive for persons with disabilities are commendable, but there are still challenges to overcome. With continued dedication and collaboration, we can ensure that every citizen, regardless of ability, has access to quality healthcare. Remember, health is wealth. This story has been made possible by Nigeria Health Watch with support from the Solutions Journalism Network, a non-profit organization dedicated to rigorous and compelling reporting about responses to social problems.